like to thank the Speed because they have designed the lectures in a very beautiful format. Speed app, the GTs, they are framed very nice. They actually reciprocate the entire exam. So I listened to the videos. I got the idea that what are the important things. The video lectures are amazing. They have consolidated every information very nicely.
Okay, I bring in all the wishes and greetings from Speed Medical Institute and Faculty of Speed to Dr. Lehar Batra for scoring a topmost rank of 26 in NEET SS Respiratory Medicine Group in 2025. Congratulations to you, Doctor.
Thank you, sir.
And also thank you for taking your time out and to share your valuable experiences with us and also to the students watching this video.
Thank you, sir.
And we want to know your brief background, where you started till date, what all you have done and accomplished.
So I have done my graduation from Lady Harding Medical College. Then I did my post-graduation from Vallabhbhai Patel Chest Institute. I completed my MD in 2025 January, and then March was my first attempt for the NEET SS, which was NEET SS 2024. That time I did not score a very good rank, but then I got a really good idea of the exam. So yeah, that is my background history.
Great. So from that previous NEET 2024 to this exam, what was your changing experience to upgrade your rank?
SS 2024, I realized the questions are majorly framed from the textbook, but then clinical questions were a little more heavier on the next this exam. So the entire idea was to actually consolidate all the information that is written in textbook, then to be able to apply those knowledge into the questions. Questions were not like straightforward; they were very clinically based. So I think that was the idea that I got from the last exam, and then I based my strategy on that.
Okay, very good. And so what was the strategy for this exam? So how did you change, what change you made to make upgrade this rank?
I think there were a few sections that were very weak in my preparation part. So every time I would do the revision, I would make a strong emphasis on those areas. So I think it is very important to use the weaker areas which you actually get to know in your GTs. So speed up the GTs, they are framed very nicely. They actually reciprocate the entire exam very well.
Okay,
So yeah. So I listened to the videos. I got the idea that what are the important things. Then the guidelines important. So once you have an idea that okay, these are asked, you consolidate all the information that is given in textbook guidelines, and then if you are able to revise everything in next every 10 days, so that is how you would know that okay, this is the speed and this is the kind of knowledge that you have consolidated would help you. No, so I was just saying that the entire strategy was very much facilitated by Speed app, and I use the app the resources according to my own needs. So the video lectures by the faculties are amazing. They have consolidated every information very nicely. And then GTs would help you know your weaker areas, and bank is framed in a way that you get the entire idea of what questions are supposed to be focused at.
great, wonderful, and great sharing. And it will be very useful for the students who are following it. And also I want to know how many questions you attended this exam. What was the experience of this paper for you?
Sir, I left 6 questions. In each section, I left 2 questions. And those 2 questions I left because I was not able to rule out the 2 options. And secondly, the strategy and the paper that I found was to be very clinical. This time the paper was very clinical, and there were few tough questions as well. But I think if you're able to if you're able to revise Fishman and the textbook four times before preparation, you'll be actually able to realize that okay, these are the lines which are written in Fishman, like directly they're bringing up those lines into the options. So that gives a lot of confidence for the line of strategy that you have followed your entire preparation, and that gives you confidence even during your exam. You're able to perform well.
Great, great, and wonderful to know, and very good it is. Thanks for sharing.
Thank you,
And
sir.
also, what will be your message for the future aspirants of NEET SS Respiratory Medicine Group?
I think so. It's very important to actually read the textbook, the guidelines, and more than that, the because the paper was very clinical, the ward and the bedside learning is very important. So if you're able to read the clinical scenarios and conditions during your ward, I would suggest that start early and then spend a lot of time during with patients. the kind of learning that you receive in your wards while you're dealing with patients would be the topmost, because the questions were very, very practical, clinical based, and acumen was supposed to be there, which you actually developed during your wards and your postgraduate training.
Great, great. Good to know. Doctor, time to thank and whom all you want to thank. You feel that I helped you from day one till date. You can use the platform to do so.
The God, my parents, my family was very supportive. The entire motivation of doing DM, like starting from being a doctor and then getting into DM, my elder sister, she has completed her DM neonatology, Dr. Sakshi Batra. And then I would like to thank the Speed faculty, because they have designed the lectures in a very beautiful format. And then my postgraduate college, the faculties, especially Dr. Nitin Goyal sir, he was my guide. He helped me develop the clinical acumen majorly over the postgraduate training. And my friends, my support system, they have always been there when I was feeling exhausted.
Great, great, wonderful. We once again wish you all the best and all the success for a great career as a DM super specialty in pulmonology. Best wishes.
Thank you, sir. Thank you, sir.